Goeienaand, good evening, fellow South Africans and citizens of the world. Now, there is a crisis happening in the eastern and western parts of Africa, from Kenya all the way across to the Democratic Republic of Congo. And the crisis is in the form of a very, very nasty disease called Ebola. And very little is being spoken about it in South Africa, despite the fact it is so easily transmitted from human to human. And it has recently spread into Kenya. And I will show you a map of Ebola's places where it's been found in the past, and you can see how South Africa is just waiting to have it appear amongst its local community.
Tu as froid? Tes paramètres, hein? Tu as froid? Tu as froid? Ok. Excuse-moi. Excuse. Ah, tiens, Hassan. Combien de temps? Combien de mois? 5 mois. D'accord. Ok, pas de souci. On va essayer de trouver. Oui? Gloria.
Ça va bien. Oui.
Amen.
Okay, let's get a bit of the history of Ebola, because I think people need to understand what this virus is all about. First identified in 1976 in what is now the Democratic Republic of Congo, or DRC, the Ebola virus has resurfaced in recent years, claiming thousands of lives and putting local and global health systems to the test. The disease was mostly confined to small outbreaks in remote settings until 2014, when it hit urban areas in several West African countries and traveled as far as the United States. The historic epidemic killed 11,316 people, more than 10 times the number from all previous outbreaks combined. The World Health Organization, or WHO, criticized for its slow response to the crisis, has since been working with other international institutions and donors to boost their ability to stem such outbreaks, but the agency and its response partners have continued to struggle to control the disease despite the use of an experimental vaccine. As a new outbreak in the DRC in 2018 grew to become the second largest ever. What is Ebola? Ebola, formerly called the Ebola hemorrhagic fever, is a rare, severe illness that attacks its victims' immune systems, causing extreme fluid loss and often death. The disease disrupts blood clotting, which can lead to internal and external bleeding. Shortly after infection, victims typically experience fever, muscle pain, headache, and sore throat, followed by vomiting, diarrhea, rash, and bleeding. Symptoms appear, on average, 8 to 10 days after contact with the virus. Fatalities, most often caused by severe dehydration, can occur within a week after initial symptoms. How do outbreaks start? People contract the disease from contact with animals, usually bats, but sometimes primates, or from cooking or eating contaminated foods. Human carriers can then transmit Ebola to others through bodily fluids. Their bodies remain infectious after death. Unlike the common flu and measles, which are airborne, Ebola is relatively difficult to contract. An outbreak is considered out of control once it reaches a threshold where each victim is infecting 2 others. Where have outbreaks occurred? The virus is named after the Ebola River in northern DRC, where it was first identified. Home to 9 outbreaks since the disease's discovery, The DRC is a reservoir for the virus, medical expert Peter Piot told Scientific American. The largest outbreak, however, occurred in West Africa from 2014 to 2016, killing more than 11,000 people, the vast majority of whom lived in Guinea, Liberia, and Sierra Leone. Prior to that, the largest outbreak was in Uganda in 2000, in which 425 people were infected, and half, or 224, died. Most other outbreaks have occurred in Gabon, the Republic of Congo, and South Sudan. Through international travel, has led to cases of Ebola in Western countries, including the United States. Cases of the disease have more often occurred in isolated areas, providing a sort of natural quarantine to keep Ebola from spreading. But some experts say deforestation across parts of Africa's tropics, which is putting more humans into contact with animals, could contribute to more outbreaks. How is Ebola contained? Healthcare workers typically place the sick under quarantine to keep the virus away from the general population during its 21-day incubation period. Using protective equipment, they screen potential Ebola carriers for symptoms and travel history. People in high transmission countries are generally told, as part of public awareness campaigns, to avoid physical contact such as hugs and handshakes. Families are also encouraged to bring sick relatives into clinics instead of caring for them at home. Because the corpses of Ebola victims can be more infectious than living victims, health workers warn against traditional burials, which include washing and touching the dead. Other measures suggest to prevent the disease from spreading have been more controversial. Some US politicians have called for travel bans in countries experiencing outbreaks. However, many experts say travel restrictions could be counterproductive. Several cases of Ebola were diagnosed in the United States during the 2014-2016 outbreak, but President Barack Obama decided against imposing US travel bans on West African states, saying that such a policy could hinder the transport of health workers and supplies and prompt people to avoid screening. Is there an Ebola vaccine? There is currently no licensed vaccine for the disease, but experimental treatments have undergone clinical trials. In May 2018, health workers in the DRC began using an experimental vaccine developed by Merck, the US pharmaceutical company, which appeared to be the most effective in tests during the West African outbreak. Health workers routinely use ring vaccination, vaccinating primary and secondary contacts of infected persons to contain the disease. Alternatively, treatment includes rehydration and plasma infusion from Ebola survivors who are believed to possess antibodies to the disease. Why was the 2014 outbreak in West Africa so deadly? Unlike past outbreaks, which were generally confined to remote areas in Central Africa, this epidemic had spread to several communities before being identified as Ebola. By the time the first diagnosis was made in early March 2014, the virus had already struck multiple villages in Guinea, and cases were suspected in Liberia and Sierra Leone. Many experts have noted that the breadth of the outbreak was in part a function of wider road access between communities in Guinea and across its borders, including into the three countries' capitals, where the disease spread rapidly. By the end of 2015, more than 28,000 people across 8 countries were infected. More than 11,300 died. So it's about a death rate of about 50% if you get Ebola. The disease's ability to spread was largely due to the stricken country's poor health infrastructure, experts say. Prior to the Ebola outbreak, there had only been 50 doctors in all of Liberia, a little more than 1 per 100,000. There are more than 200 times that proportion in the US. Now, if you look at South Africa and the health system right now, it is in complete decay. They would not be able to handle an Ebola breakout, and especially if it happened in one of the major cities like Johannesburg or Cape Town or Durban. It's a ticket to absolute chaos and disaster. This is why we need to know what Ebola is all about. Physicians and public health expert Paul Farmer has written that Ebola is more a symptom of weak healthcare systems than anything else, adding that with proper supplies and trained personnel, the disease could have a 90% cure rate. Moreover, many health officials have criticized the WHO, hobbled by recent budget cuts, for not declaring an international public health emergency until August 2014. If the response had been much earlier, in the spring or earlier summer, there wouldn't have been the need for nearly as much money and not nearly as many people would have been infected. Georgetown University Medical Center Daniel Lucy, who cared for hundreds of patients in Liberia and Sierra Leone during the epidemic, told the paper. Have there been any other serious outbreaks since 2014? The DRC has experienced several outbreaks since the West African crisis. The first in mid-2017, which killed 4 people, was contained in a relatively remote area in the northern Bas-Uele province and declared over by early July. A year later, the disease returned, this time in the country's northwest and soon after its northeast North Kivu province. By mid-2019, the North Kivu outbreak had become the second largest in history, with a death toll of more than 1,300. The Northwest outbreak was declared over within 3 months. Violence in the region, where a decades-long conflict has continued to simmer, has undermined efforts to curb the outbreaks. So that's a bit of a background to Ebola, just so you know what it's all about. Now let's get an update as to exactly what is happening with Ebola right now. Okay, some 1,650 people have died as government officials and aid agencies have struggled to contain the virus during this year, 2019. And they're now calling the Ebola outbreak in DRC, or Democratic Republic of Congo, now a global emergency. An Ebola outbreak in the DRC now constitutes a global health emergency of the World Health Organization, or WHO, has said. Some 1,650 people have lost their lives as government officials and international aid agencies have struggled to contain the virus over the past year, with fears it could spread to a major city in the Central African country. Well, imagine if it spread to Johannesburg or Pretoria. WHO says concerns over the death of a 46-year-old pastor in Goma, which is home to 1.5 million people, had resulted in the heightened threat level. We understand that the pastor traveled for 3 days in a bus before he reached the bustling city, and surveillance teams have only traced 8 of his 18 or more fellow passengers. Experts say it would be extremely difficult to control an outbreak in places like Goma, and the upgraded crisis should see more specialists and resources arrive to combat the virus. But despite the outbreak being classified as a global emergency and WHO reporting a new case of the virus in neighbouring Uganda on Wednesday, no restrictions on travel or trade have been introduced to date. There will also be no screening of passengers at ports or airports outside the immediate region. So really all you need happening is someone who's infected with Ebola to arrive at OR Tambo, mixed with the population, and bang, presto, you now have Ebola in Johannesburg. WHO Chief Tedros Adhanom Ghebreyesus said the recommendations had been made by a committee of international experts which stressed there was no need to introduce any restrictions outside Congo at this stage. The ongoing outbreak is amongst the worst in history, and the battle to combat the virus has not been helped by armed assailants having targeted several centres set up to treat those infected. Last December, we visited a similar centre set up in the city of Beni, where 200 health workers were tasked with treating those admitted. They erected a series of innovative air-conditioned tents to house and treat the more serious cases, but there is no cure for the disease, which kills more than half of those it infects. The deadliest outbreak ever was an unprecedented crisis in West Africa, which killed more than 11,000 people between 2013 and 2016. So I'm just putting that out on the record. on this channel. So if something happens and Ebola does arrive in South Africa, bookmark this video so you've got all the background information. All right, guys, please remember to subscribe to be kept informed. Ring the bell for updates, and have a great evening. Bye for now.